Brucellosis is a bacterial disease caused by various species of the Brucella bacteria, with Brucella canis being the specific strain that affects dogs. It is primarily transmitted through direct contact with infected animals or their bodily fluids, often during breeding, ingestion of contaminated materials, or contact with infected tissues. The disease can also be spread through contact with infected urine, blood, or other bodily fluids. Symptoms of brucellosis in dogs include lethargy, fever, weight loss, swollen lymph nodes, and reproductive issues such as infertility or aborted pregnancies. However, some dogs may not show any symptoms, making diagnosis challenging. Veterinarians typically use a combination of clinical signs, blood tests, and tissue samples to confirm the presence of the Brucella bacteria, with serological tests like the rapid slide agglutination test or polymerase chain reaction used for detection. Treatment options for brucellosis in dogs are limited and often not entirely successful in eradicating the infection. Antibiotics like tetracycline and doxycycline can manage symptoms and reduce bacterial load, but may not completely eliminate the bacteria. Spaying or neutering infected dogs is often recommended to prevent spreading the disease through breeding. Quarantine protocols and hygiene practices are crucial to prevent transmission to other animals or humans. Preventing brucellosis in dogs involves practicing good hygiene and biosecurity measures, especially in kennels, breeding facilities, or areas with high animal densities. Regular testing and screening of breeding dogs for brucellosis can help prevent the spread of the disease. Owners should work with veterinarians to develop a prevention and control plan tailored to their dog's needs. Additionally, brucellosis can pose a risk to human health through direct contact with infected animals or consuming contaminated raw dairy or meat products. Symptoms in humans are similar to those in dogs and may include fever, fatigue, joint pain, and muscle aches. Preventing transmission from dogs to humans involves practicing good hygiene, wearing protective gear, and proper sanitization when handling potentially infected animals. In conclusion, brucellosis is a serious disease that affects dogs and poses a risk to human health. Early detection, proper diagnosis, and appropriate treatment are crucial in managing brucellosis in dogs and preventing its spread. By following strict hygiene practices, implementing prevention strategies, and working closely with veterinarians, dog owners can help reduce the prevalence of brucellosis in their pets and minimize the potential impact on public health.